We have been talking about how to maintain a healthy spine and also how to avoid having disc problems or hurting our lower back. So we talked about how in our lower back from the side there is a forward curve called a lordosis, so this is called a neutral spine. And it's important because there's loads and pressure in our back, and when we repetitively flex or hinge from our lower back, like when we sit or we bend over and we lift things and we don't maintain that normal curvature and we're not hinging from our hips, then what happens is we put abnormal stress and loads on these fibers that hold this nucleus or this disc material in when people think of a slip disc. So this, I'm going to show you a model here, and in this particular model there's actually a tear in the disc on the right side. So when we turn it to the side, you can't probably see this, but there's a line there. But when we maintain a neutral or curved spine like that, we can handle loads and pressure. But when we hinge or flex over and that material can bulge out and put pressure. So that's how you end up herniating and bulging a disc. And we see this a lot in people that sit for a living, truck drivers, that don't maintain that neutral spine, and that's also why they have lumbar supports to support that. Or in the gym, I watch people all the time doing squats or bending over, and they flex and bend that, they bow that back backwards, and they're really not hinging from their hips and maintaining a neutral spine. So that's a good way to herniate or bulge a disc. So most people think of lifting something and twisting, and you're vulnerable to hurting your back with that as well. But a lot of people don't understand is sitting prolonged, and when the muscles aren't kicked on and the ligaments and discs aren't holding it in, then over time they could develop weakness, and then they go to throw a piece of paper away, or they just bend over and then they blow their disc. So a lot of times it's repetitive loads with a repetitive flexion of their back. So if you're experiencing any signs and symptoms of a disc problem, or having back pain, or having any leg pain, weakness, numbness, tingling, you might be having a problem with your disc.